Thank you and good afternoon, all the distinguished guests. Focusing on the topic for this session, which is to share examples of South-South and triangular cooperation, I would be highlighting here a couple of examples from Bangladesh, which can be of interest to guests, colleagues, friends sitting here. As we speak, there are about 80% countries in the world who will not achieve their maternal mortality ratios if they do not do business as unusual, meaning if they continue doing business as usual, they will not be able to achieve that target. We have some learnings from Bangladesh whereby this can be turned around if there is commensurate commitment at political level and at the policy level, which is the midwifery program. Midwifery program, I don't know how many of you would know, but the midwifery program of Bangladesh is one of the very, very successful stories globally. Through our networks, through our headquarters, we keep getting requests from different countries to share our experience and also to be supporting midwifery programs in their countries. Midwifery program in this country is a really remarkable program. It is not a very old program. It all started in 2010 when the Prime Minister, Honorable Sheikh Hasina Madam, she announced in the General Assembly that she will be creating 3,000 positions of midwives to really accelerate achievements on maternal health and reducing maternal mortality in the country. And then we are here today where this country is producing almost 5,000 midwives every year from 109 private nursing schools and about 62 public midwifery schools. Government has already deployed about 2,500 midwives in the public health facilities. And the support that UNFPA has been providing to government of Bangladesh, not only in creating this program right from the scratch, is demonstrating that deployment of midwives is really reducing maternal mortality very, very significantly. What we have noticed very specifically is that deployment of midwives at the primary healthcare level facilities have increased institutional deliveries by 171% over a period of just about 2 years. And if you compare this with the deployment of midwives at tertiary level hospitals and the secondary level hospitals, this percentage is way too high. So the advocacy that we are doing in Bangladesh is to deploy on a priority basis the 5,000 midwives which are coming out of the schools every year to 5,000 odd primary health care facilities in the public sector in in Bangladesh. And this advocacy, this consistent effort of government of Bangladesh supported by UNFPA and like-minded partners and donors has really given some positive dividends whereby government has already created 5,000 plus 2,000 midwifery positions. This has to go through the entire cycle of approval, financial allocations, etc. But the first step has been taken whereby the creation of so many extra number of midwifery positions. So this was the context of why midwifery program is so important globally and also for many countries in the region for reducing maternal mortality within the foreseeable future, which is 2030, that is the SDG targets for most of the countries. Given this context, Nepal, government of Nepal reached out to us to provide them support in developing their midwifery program. And this partnership is quite advanced, whereby we are working with them in supporting the development of their strategy. There has been exchanges of colleagues of senior level officials, and we have also agreed to provide some type of mentorship services or facilities to Nepali delegates in Bangladesh institutions. At the same time, government of Egypt has also reached out to us to support developing the midwifery strategy, whereby we are providing them the support. And as I said, that there are other countries also. There is a partnership with Government of India also, whereby Government of India has requested Government of Bangladesh to provide some midwifery, potential midwifery faculties to be deployed in the midwifery schools in India. The progress on that has been that we have provided a list of a couple of eligible midwifery faculties. They have been interviewed by Government of India, and they are in the process of deployment. So this is one example where I would see that there is a potential of South-South collaborations. Audience sitting here, I think if this area seeks or attracts the attention, then Government of Bangladesh will be very much willing to provide that support to the countries. In addition to that, I would also highlight 2 or 3 other examples. Number one is about the shift from funding to financing. I think under the leadership of Government of Bangladesh with support from UNFPA, much of SRHR critical interventions have been included in the ongoing development of the 5th sector plan, which is going to be starting by the end of this year, or I guess early next year. It was supposed to be starting from 1st July 2024, but I think it is slightly delayed. It will be on the ground next year. So this is the result of our work together with Government of Bangladesh, whereby the consistent work over several years have really generated evidence which could not avoid the attention of Government of Bangladesh, and as a result of which, and as a result of our advocacy, those things have been included in the next sector plan of Government of Bangladesh. Third point that I would like to also share with you is that Bangladesh has a very good example on strengthening or building the resilience and adaptability of the community and the systems respectively on climate resilience, climate change resilience. We are doing some unique work in Bangladesh whereby we are showing the link between the climate change and SRHR. And primarily, this is a very simple concept that we are implementing, which is to creating awareness within the community about what climate change is, how it is impacting on health, and particularly how it's impacting on sexual and reproductive health. It may appear to be very intuitive, but I think it is not so. We think that people know about what is the linkage, but it's actually not. And this is such a low-hanging fruit, but the scale of it is so massive that it becomes, in that sense, a money-intensive, resource-intensive area, because you have to provide that information, that awareness to each and every citizen of different countries, of all the countries, globally speaking. And more so to the people who are in the remote nooks and corners of the country, who are the vulnerables. So this work itself, a very simple work of creating awareness about what is climate change and how it's impacting you and what you can do at your own personal level. It's a very, very simple, logical sort of framework, but it requires really intensive investment. But it is a low-hanging fruit. The returns which are going to come out of it would be massive. The last point that I would just like to also share, where we have some experience and where we would like to explore more learning from other countries, is our Rohingya response. UNFPA is one of the very important partners, along with all other UN agencies and different donor partners and all the different stakeholders, on providing support to Government of Bangladesh in giving shelter to Rohingya refugees. I would like to take a minute here to acknowledge the generosity and the open-heartedness of Government of Bangladesh in welcoming Rohingya population, and also that of the donor community in kind of generously providing support to supporting Rohingya communities. And at the same time also providing support to the host communities by way of providing support to strengthen the infrastructure, the services, the facilities to be able to provide that support to the Rohingya communities. Here we have done tremendous work. I think the work has been really acknowledged. There was a time about 7 years back when there was a lot of struggle. I think it was all very chaos. But today, very recently, about 3 weeks back, we conducted, under the leadership of Government of Bangladesh, a survey, SRHR survey in the camps, and it is showing remarkable results. The contraceptive prevalence rate, which used to be about under 10%, about 4 or 5 years back, it is about 55%. The uptake of long-acting reversible contraceptive methods, which is under 1% nationally, is close to about 8% in Rohingya camps. Unmet need for family planning, which is 12% for the country, it is about 8% in that community. So the work is paying dividends, but the need is tremendous. So I just wanted to say that this is an experience that we have in managing almost 1 million refugee communities in Bangladesh. And we would like to have learnings from other similar countries where they are managing such type of influx, and we can learn from them, and also we can share our learnings with them. So, Honorable Chair and distinguished guest, I think those were my 4 real sort of examples of South-South cooperation and triangular cooperation, which is on the ground playing out as I speak. And then these are potential areas of collaboration with Bangladesh, with many of you, and then Bangladesh also collaborating perhaps with you on the path to learning more and to be achieving our common ICPD goals. Thank you very much.